The American public continues to need more clarity on the congressional bill, but overall still supports healthcare reform because it may ultimately define the future of many citizens who, like Ivan Ondina, are being affected by the current state of the healthcare system.
I do not have health insurance because I recently got laid off of my work and I was working in Phoenix, Arizona. I relocated here back to New York and I'm working part-time at a job, and right now I don't get enough hours to get my benefits.
Research and data show that medical bills prompt more than 60% of U.S. bankruptcies, including those who are already insured and, most significantly, those who aren't. For Ivan, the thought of needing medical care is almost out of reach.
I've been able to get around my sicknesses, with over-the-counter drugs, but definitely if I do have to go, like right now I have a root canal that I have to fix in my mouth, and I do not have dental or medical insurance, so it will be pretty harsh for me at this point in my life because I already have student loans that I have to pay and bills on a daily basis, so dealing with medical sickness, it will be awful at this point, without health insurance.
Ivan's hope on healthcare reform has been put on hold, not by his own accounts, but by policymakers still trying to come to terms across the aisles on a bill that will satisfy both the citizens and the private corporations.
I would prefer, if anybody in my position could have health insurance, just like countries in France and other countries that are already providing those services to the population.
The public's anger towards the unsolved resolutions in Congress and lack of vision from President Obama and his administration has people like Ivan double-guessing the U.S. system and their ability to resolve problems in Washington, D.C.
It tracks my mind like it's a little bit of bureaucracy, and then it's an ongoing process that we've been debating for like 30 years now, since Nixon or Reagan, I'm guessing. But if it doesn't pass, it will be a hard punch on the United States economy and the population, trying to survive, and especially because the cost of living has been increasing at a tremendous rate, and then job salaries has been stable for the last 20 years or so.
As the days go by, many other important issues will mount up. Priorities will be set in place, and solutions will take time. But where will healthcare reform stand for the millions affected? People like Ivan will be waiting for an answer.
Hopefully, either I get more hours or the bill gets passed and, we move on, because the economy is doing so bad and the people are decaying, and it's not healthy for the population, I guess.
The American public